very good morning. Hope everyone are doing fine. So in this class, I would like to discuss you regarding the job responsibilities of an health assistant male. So we have seen the job responsibilities of A&M, the job responsibilities of staff nurse, the job responsibilities of a health worker, female and supervisor. And now we want to see the job responsibilities of health assistant male. So here, we have in previous class, we have seen the job responsibilities of health assistant female. Now I would like to discuss you the job responsibilities of health assistant male. So here the male population in the health assistant male, he covers up to 30,000 population in plain areas and in tribal 20,000 population. So there is one male health assistant for every 6 sub centers, and job responsibilities are like supervision and guidance. So he is the one who is responsible to guide the male health worker at sub center under his population coverage. So he should help them in enhancing their knowledge as well as skills of the health worker male, and she should guide the health worker male mainly to plan to organize the various types of activities. So she should visit every health worker once a week on a fixed day, and mainly for the supervision as well as guidance, and he should submit the reports on the progress of work to the medical officer of primary health center. So most probably all the activities that were being carried out, they will be similar to the female health assistant. So here also the teamwork comes into play. So he should coordinate the activities with the health assistant female as well as dayas and health guides. He should coordinate the health activities with other departments as well as agents, and he should conduct staff meetings for every 15 days on the sub centers by rotation, so with health workers in coordination with the health assistant female. So both health assistant female and health assistant male, they conduct this staff meeting, and they should attend the staff meetings at PHC, assist the medical officer in the various health aspects, mainly at the level of PHC, and they are the one who are responsible to conduct camps as well as campaigns in the health programs, and they should assist the medical officer mainly in conducting training programs at various levels. So they should include the health personnel, and they should conduct, and they should facilitate and participate in the village health and nutrition day. And nextly, supply equipment and maintenance of the sub center. So as we have discussed, so he should collaborate with the female health worker. So the female health worker, she checks the indent and she provides supplies to the sub center at a time. So as a health assistant, he should coordinate with the female health worker, and they both should ensure that the equipments that were needed by the sub centers and PHCs are meeting or not. So it is their responsibility. And he should check the maintenance of generalized kit for the male health worker, and records and reports whether they are doing or not in an appropriate manner. He should check, and he should submit the monthly report to the medical officer by reviewing the records of health worker male. And in malaria, so he should minimum visit at least 100 houses. So during his visit, he should collect thick and thin smears of the suspected fever cases. So who are having suspected fever, those patients, he should collect the sample, and he is the responsible for providing the radical treatment to the positive cases of malaria. So he is the one who should collect the samples, he is the one who has to check, and he is the one who should give treatment, and he should supervise the spraying of insecticides in the particular area. Nextly, in Kala Azar endemic area, so what are all the health houses that were visited by the health worker male, at least 10% of those health visited homes should be checked by this health assistant male, whether they have done in an accurate manner or not, whether they have done any kind of mistake. So he is the one who is responsible to check, and he should check, he should identify whether the treatment that was given by the Kala Azar, whether the treatment, he is the one who should check and identify whether the treatment which was given for this Kala Azar by the male health worker was complete or not. He has to check, and he carries all relevant records, diaries and guidelines for identifying and suspecting the Kala Azar cases, and he is responsible for ensuring complete coverage treatment to the Kala Azar patients in his area. He is the one who is responsible to spray the insecticide. So whether they have sprayed or not, he is the one, and he is responsible for the health education. So his role in the endemic areas of Japanese encephalitis, so again supervision of health worker, So in the houses that were checked by the male health worker, she has to go and check at least 10% of the houses, and he should perform health educational activities. So again, in the lymphatic filaria, the same responsibilities are there. He should supervise the male health worker, has to check 10% of the houses that were visited by the male health worker, and he should ensure that the coverage of the drug compliance is above 80%, and health educational activities in communicable diseases. So he is the one who is responsible to alert the higher officers. So whenever he comes to a disease, whether it is an epidemic or endemic disease such as diarrhea or dysentery or acute eye infection, so immediate measures should be taken care so that the disease is not being spread or the disease is not going out of hands. And he is the person who is responsible for controlling the stray dogs, and he should take the help from the male health worker as well as the local authorities. Same in leprosy also. So in leprosy cases, he is the one who is responsible to know whether the treatment that was being delivered to the patients was in an appropriate manner or not, and he should assess and monitor grade 1 and 2 disability for leprosy disabled patients. Nextly, tuberculosis. So he should check all the medical activities, so whether the patient has received, so this during this DOTS therapy, he is the one who is responsible for their complete treatment. And in non-communicable diseases, so he is the one who is responsible for the promotion of health as well as the IEC activities. So he is responsible for motivating the people, so mainly in environmental sanitation, community sanitation, safe water supplies and soakage pits, kitchen gardens, manure pits, composite pits, sanitary latrines. And ninthly, smokeless chullas, and supervise their construction and supervise the chlorination of water sources including the well. So all these things are mainly done by the health worker, health assistant male. And nextly, universal immunization program. So as a male worker, so he should coordinate and he should maintain the record of all under 5 children and the maternal mothers, along with the female healthcare worker or female health assistant. He has to motivate each and every individual who is eligible for this immunization, and he has to give proper immunization to those people who are eligible. And nextly, he should guide health worker male mainly in establishing the family planning report holders, and he should supervise their function. And nextly, provide information services for the medical termination of pregnancy, and he should refer the suitable cases for approved institutions. And he should mainly participate in the family planning methods. So for the males, vasectomy, either tubectomy or intrauterine devices, or family planning acceptors. So this is the job responsibilities of male health worker. So if you like the content, please like, share and subscribe the channel. And I have discussed the job responsibilities of all community health nursing personnel in my previous classes. I request you to go and check those classes also, so that you can have clear data. Thank you so much. Thanks for watching. And if you have any queries, drop them in the comment box, and any suggestions for me, please drop them in the comment box. Thank you so much. Thanks for watching.